This is a picture from my camera just last week from my home, Northern Lights. Um, and I always start my presentation with a centering exercise. So I would like you to just close your eyes and we are going to practice gratitude. So take a deep breath in, a deep breath out, a couple of deep breaths. And think about what you're grateful for today, in this moment. It could be a person, a thing, a situation, a place, anything that you're grateful for. I'm very grateful that I'm standing in front of you and talking about our common goal of supporting and promoting Ayurveda in this country. Thank you. So I was telling you the story about the American Board of Integrative Medicine. So we are coming to the fellowship. So when the board said that we are now only going to have fellowship trained physicians that we are going to board certify, we didn't know how to go about Ayurveda. So MIU that I had known about for almost 2 decades, Dr. Robert Schneider, who is a cardiologist here, he is now retired. He ran the NIH Institute on Hypertension Studies here. This MIU was the NIH Center for Excellence in Cardiovascular Diseases. So Dr. Schneider and I have known each other for 2 decades. I invited him to Albuquerque when I was there at UNM to give grand rounds. So Dr. Schneider contacted me, and he actually contacted University of Arizona, where I did my integrative medicine fellowship, where Malini did her fellowship in integrative medicine. And Arizona said, you need to talk to Arti because she ran this task force. She knows about Ayurveda training and all of that. So he reached out to me. And that's when the idea was born that we need to have a fellowship focused on Ayurveda, because there's nothing in the country that for physicians which trains them as a physician who can practice Ayurveda. You have lots of Ayurvedic certifications. You can become a counselor. And if you are happen to be a physician, then you can practice, but this is specifically for physicians. So we subscribe to 500 hours of curriculum, the basic, which we call the foundations of clinical practice in integrative medicine. We subscribe to that. We pay for that through the fellowship to University of Arizona to get the 500 hours of curriculum. And then we have taken 500 hours of curriculum from the master's program in Ayurveda, which is at MIU. And MIU has bachelor's program in Ayurveda, master's program in Ayurveda, and we have merged them seamlessly, very beautifully. And that work was presented by Dr. Wegman at the Academy meeting. So that is the fellowship. It's for 2 years. It is long distance online fellowship, and you spend 1 week each year here on the MIU campus. Yeah. You come to Raj also, but basically you come to MIU campus and you learn hands-on clinical experience. And I'll share something with you. You met Dr. Wegman. Dr. Wegman, can you just, okay, so she's the assistant director of the fellowship, Dr. Shankri Wegman. She welcomed you on Wednesday night, I understand. And a very important plays a critical role in our curriculum design. That's Dr. Charles Elder and Dr. Leslie Elder, whom you're going to meet tomorrow morning. They're going to do their presentation remotely tomorrow morning. So that's the last 1 hour of presentation is Sunday morning. And we were actually all here at MIU, so we could not travel back again. We were all at MIU because the fellows were here. So we literally we were here, we went back, and then I came back, and Shankri lives here, but they live in Florida and they could not travel again. So I want to share the story of Dr. Harshita with you. She's in our class 3, which is our largest class of fellows. We launched this fellowship 3 years ago. This is our 3rd class. Dr. Harshita did not know about the fellowship. Her parents went to the table of MIU and fellowship 3 years ago when we were launching the fellowship at one of the RP conferences. and that was the one in Cincinnati, I believe, somewhere there. So they went there and they were very intrigued by the fellowship, and they said to them, Dr. Elders and Shankri, that it's a great fellowship, but I don't think we are in that stage in our career that we should take the fellowship. They went home and talked to their daughter, and Dr. Harshita has joined the fellowship. She's a neurologist, and she came here with her little baby. Parents came too. They took care of the baby while she was doing her fellowship week here. So I think the point is that everyone has time and space to learn about Ayurveda, and you can utilize it many different ways. Some people are doing their second careers in the fellowship. They're done with conventional medicine, and they said, I'm learning it for personal reasons. It's going to help me benefit me, my family, or I'm going to now just work part-time and doing this Ayurveda consultation. Some of them are active physicians and clinicians. You will see we have all sizes and shapes and colors of people in this fellowship. It's not only just Indian people. We have Caucasian, we have Hispanic, we have Black people, and we have people from different parts of the world who are clinicians here. And they are loving the fellowship. This is our second class of fellowship. First, we already graduated. Many people passed their board exam. And then this is our second, that's the third class, largest class. Here I'm showing you that they are actually, Dr. Shankari does a wonderful exercise of teaching people how to feel the pulse and the qualities of the pulse. So she puts lots of different items on the table, such as cotton balls, such as ghee, such as cream, lotion. You feel it, and this is how we actually learn about the Ayurvedic pulses, because you have to describe the subtle qualities of the pulse. So the fellows are participating in that. They are learning about Ayurvedic cooking, Abhyanga, and Vastu. And you also got some of that presentation about Vastu. People are very happy. And I talked to many fellows last week, and they told me that they could have gone to do the Arizona's fellowship. They could have gone to do the San Diego's fellowship. But it was very interesting to hear that they said that we wanted to have a fellowship which had a spiritual meaning. And Ayurveda has a spiritual connection to yourself and to the world and how you relate. And that was the most intriguing part for them to join our fellowship program. I just want to show you that we are still a small program. This is the class of fellowship of Arizona, much bigger. That's the largest fellowship program in the country, the one that I did, Malini did. And this is our class as of last year. We have various specialties represented here. We have surgery, ENT, neurology, family medicine, internal medicine, psychiatry, urgent care. And we also opened it up for chiropractors. So we have one chiropractor who has joined our fellowship program. So it's never too late to learn about your own culture and your own medicine. So 3 years ago, when we launched this fellowship, I contacted Dr. Amit Chakravarti because I felt that if API cannot support and promote this fellowship, physicians of Indian origin, who else will do it? So when I contacted him 3 years ago and I said, I would love your help to promote this fellowship through API, he said, I'll do that when I become the president. 2 years you're on your own, but I will support it, and I will make Ayurveda a very special focus of my presidency. So we had his commitment. He connected me to Dr. Amit Shah because Amit Shah was separately talking to him about it. I did not know Dr. Amit Shah until 3 years ago. So he connected me to Dr. Amit Shah, and he and I talked. And he was, individually talking with MIU at that time. He had just learned about the fellowship. So Amit and I got together and we created, with Dr. Amit Chakravarti's approval, in a way that we would create an API Ayurveda consortium. And this consortium is going to have a variety of members. And the vision is to integrate ancient wisdom with modern science, creating integrative medicine model for personalized wellness. And we launched this website also. There's more that needs to go on the website, but at least there is a page. So this is actually kind of our first event as API Ayurveda Consortium to have this retreat and have a CME program. So you are here for a purpose. You just didn't happen to show up on Vedic land. It has, thank you. So this is how we are going to promote it. And we are going to have a full half-day session at the Global Summit also in Bhubaneswar. Misha and I am traveling, and we are working with a lot of different constituents, even in India with Ayush, and you can tell more about it. I don't want to steal your thunder. You can talk about it. So we are going to have half-day session there, and hopefully we will also have a session at the API Annual Convention in July in Tampa. So this is why you are here. Hopefully you have tasted some Ayurveda, and now you're going to taste some more Ayurveda related topics today. So I'm coming to my topic, and I've given you the background. So integrating Ayurveda and whole health to empower yourself and your patients. So I am in the field of integrative medicine. Ayurveda is one aspect of that field that I'm passionate about. I'm passionate about many other things, but this is me coming from India. Growing up, we have all grown up with that culture in our family culture and those values that we followed, but we never questioned. And we knew there was a reason. We were not interested when we were young in those things. Like when you're told that you don't eat yogurt at night, it's like, why not? I'm going to eat it, right? So and things like that you hear from your grandmother. My dadi always would say, my joints hurt. When I know that it's going to rain, when the rainy season, my joints hurt. I will say, oh, come on, like, how do you even do that? Now, as we are learning and teaching about the science of Ayurveda, we know that there is wisdom in all of these things. So today I'm going to talk to you about, in general, about integrative medicine, and then also specifically about Ayurveda and what is happening in the country. And if we don't catch up with that, Ayurveda is going to be left behind in this country. I have no financial disclosures for as my CME disclaimer. My only disclaimer is that I believe in the art of medicine, and that we have the science of medicine, and then we have the art of medicine. And back in 19th century, this was written here in the European literature and American literature, that medicine is not only a science, it is also an art. It does not consist of compounding pills and plasters. It deals with the very process of life, which must be understood before. And I felt like they talked about Ayurveda at that time. Every process of life, that's what Ayurveda focuses on. And it guides you. And it is also low cost. There's no like blood testing involved like we do in conventional medicine or functional medicine or even in integrative medicine. Use your own body's power and wisdom to learn what's happening in the body. So we also know that American healthcare system is failing. We are the lowest performers as compared to any other developed nation. And this is the data which has been consistent, say, for 2 decades, that our healthcare outcomes are the one of the worst in the world. While we spend majority of our um, money or the GDP on treating people who are sick, we don't focus on prevention and wellness. Only 1/3 of the budget, less than 30%, is spent on prevention. And on for treating diseases, we spend 97% of our healthcare budget. So it's a very state of affairs that we also don't focus on public health models of wellness. And the funding for public health system has not increased. It has even gotten worse. It's going to get even worse starting 2026. So the American healthcare system is going to continue to fail, and is going to fail the physicians, is going to fail the people if we really don't focus on prevention and well-being. So just to give you some background of starting, as I said, I've been involved in this integrated medicine movement for 2 decades because I also had a wake-up call. I had a wake-up call because my patients were coming to me when I became a primary care doctor at UNM in internal medicine. I thought I knew about medicine. I came from India. I got trained here. I said, oh, I have to have the best of both worlds. Went into training, went into practice, became a faculty, and patients were coming to me. They were asking me questions that I didn't have the answers for. So we are just publishing an article about the story of why I got involved in integrative medicine. A patient asked me about St. John's wort. They came in my primary care practice. This was back in 1995 when I started my practice, and I had no idea what that was. And I was very down on myself. I said, I didn't study pharmacology. This must be a drug. And it was no drug. The World Wide Web was just coming up. So I had to research, and I found out, oh, this is an herb that people are taking and they're saying they like it. So I got interested in integrative medicine and herbal medicine and how to integrate that in my practice since that time. And you all have probably seen also, as people who are coming from different cultures, your clientele is probably different. Your patient clientele, you are seeing people from different cultural origins, because I think they want to have that connection, that validation that what they're doing is right. So this data started to come out back in 1990, that more people in America were seeing providers of complementary and alternative medicine than their primary care physicians, because they were trusting them. They felt like they could connect with them. And these are the different products and services that patients were using, like natural products, breathing exercises, yoga had been very popular, meditation, and all of that. And then other national trends also show that more and more people are utilizing, until 20,000 to 2022, the services, and Chinese medicine was becoming very popular, and more people were getting acupuncturist. And we always had a joke in New Mexico, which is actually true, that one of the medical students presented their research project she did, and she went to a national place to talk about that presentation, and she said that every third person in Santa Fe is an acupuncturist. And the judge said, why is that? And she said, have you ever been to Santa Fe? So that was her response, because it is getting so popular. People are getting training in alternative medicine, especially Chinese medicine and acupuncture. And if the reason we are talking about Ayurveda, because it's going to left behind if we don't support and promote it, especially as API physicians and the next generation of physicians who are going to come from us, from our families, that this art is going to not flourish in America. I'm not talking about competition. I'm talking about healthy competition and having parity. Um, so yoga and meditation, we have also excluded yoga from Ayurveda. Yoga has been very popular in this country. It has been used in gyms. It's been yoga, spin yoga, dhan yoga, all sorts of yoga is happening, and people don't connect that yoga is coming from the same tradition, that you just cannot do yoga in isolation if you don't have a lifestyle which actually supports the Ayurvedic lifestyle. And why patients use this? Because they feel very empowered. They empowered, they want to have control on their own health and well-being. And they also don't think that doctors need to know about this, because it's none of the doctor's business, because doctors laugh at them. And they also say that, I don't know anything about it. If you want to do something, go do it. That's the worst response you can give to any patient. And to say, I don't know anything about it. You said, I can learn about it. Tell me more. This is how I learn. I think patients have been my teachers. They tell me something and I support. I said, okay, I'm going to study and I'm going to come back to you and tell you if this is going to work or not work. So there has been a wake-up call for conventional medicine. This is another picture. This is my backyard in Minnesota. Yep. It's from last week. So there's a wake-up call for conventional medicine. There has been a wake-up call personally for me back in the 90s. And I said, Arti, what is wrong with this picture? And I realized that I have gotten away from my roots of medicine. I was I had always been holistic. I think we are all holistic people. As Indian doctors are the best, one of the best doctors in this country, right? People go to you, they trust you, you build those connections. So we are all holistic people, but I felt that conventional medicine training, which made me a very good internist, got me away from my roots. I could take care of people who were very, very sick in the hospital, and heart disease and pneumonia, and people who are dying. But I didn't know how to maintain wellness of people. If healthy person comes to you, and I had just come out of my residency, I had no idea. I didn't know how to manage like backaches. I didn't know how to manage ankle pain. And so I said, my inner calling was the same. And I said, I need to focus, go back to my roots. I need to study this, and I need to start promoting health. I need to create health in the community because health doesn't reside in the hospitals. We need to a public health model. So we all know the saying from William Osler that it's more important to know the person who has the disease than the disease who has the person. And conventional medicine traditionally focuses on, it's an oxymoron, traditionally focuses on the disease, right? And holistic medicine focuses on the person. And Ayurveda and Chinese medicine both do that. They focus on the person. So this is the definition of health by World Health Organization, that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. So as I mentioned, I got trained. I said I'm going to enroll in fellowship, and I was supported by my dean in that process. So I did the Arizona Fellowship. That's Dr. Andrew Weil, who started the integrative medicine movement in this country. He's Harvard trained physician. He's come on the Time magazine 2 times. No other person has come on the face of Time magazine 2 times. And we partnered with the University of Arizona. We did a lot of conferences. I considered him my mentor. And then I also did some events with Dr. Deepak Chopra in Albuquerque. Um, so getting involved, getting the word out, and really sharing the story, because I also got a lot of backlash from my own faculty and from my own colleagues at UNM. It's like, oh, she's practicing alternative medicine. I said, it's not alternative. People said, oh, is this a Hindu shrine? People have come and said that to me in my office. Oh, I like this Hindu shrine. And, now I think about it and I said, I should have just like, okay, I'm going to shoot you. But I was very welcoming and I said, oh, kind of, and they would send me all negative articles about, snake oil and all of that. And I would always be very gracious and say, thank you. Actually, this teaches me something, because then I should not be doing this with my patients. So thank you. I'm glad that some other people are doing research on my behalf. I don't have to do it. You can just tell me. So it has been a long journey in telling people that how these things support as complementary and integrative therapies, and these are not alternative. Because most of the people, the research says that most people use it in conjunction with conventional medicine for longevity, for better health. So then a lot of movement happened in the country in the last 2 decades. There's a consortium now which has defined integrative medicine. It has almost like 150 academic health centers who are part of the consortium. University of New Mexico was part of the consortium. University of Minnesota is where I am, and they define integrative medicine as the a medicine or practice that reaffirms the importance of the relationship between practitioner and patient and focuses on the whole person. The newer movement has come, and people are using the term whole health. So whole person health and whole health. Now, what does that mean? That's now coming from National Center for Complementary and Integrative Health. It used to be called, as you can see how the transition has happened, National Center for Complementary and Alternative Medicine, and it has been redefined as National Center for Complementary and Integrative Health. And the reason is that nobody can practice integrative medicine by themselves. You need a team. You need a team of providers, and it's not just owned by physicians. It can be owned by physical therapists. It can be owned by other type of health disciplines. And how do you actually work together? Um, and this is right from NIH. What is whole person health? You look at individuals' health, you look at family connections, you look at the community, and then you look at population, and you work on the whole spectrum of disease and moving them towards health. Um, so um, I'm going to skip this. So I already talked about Academic Consortium for Integrated Medicine and Health, just to show you how this movement has grown in the last 25 years. These are the numbers. These numbers are growing every day. These are hospitals and health systems and academic health systems who are joining the consortium because they have some form of integrative medicine program within them. It could be an educational program, it could be medical students, residents, faculty, or they could have a clinical program, they could have a research program, they could have a policy program, and your top official needs to support that application. You become a member, and consortium is doing amazing things for promotion. But consortium is not doing amazing things for Ayurveda. So it is our job to bring Ayurveda in there, which we have done through the fellowship, because our fellowship was accredited by the consortium. We, as the board, when I was still on the board, we used to do accreditation also for the fellowships in integrative medicine, all sorts of. And then we felt that was kind of conflict of interest. If we are also the board certifying body, we should not be accrediting fellowships. So we created a joint conference committee with the consortium, and we have given them the accreditation process for new fellowships. So MIU's fellowship was a new fellowship, and it was accredited by the consortium. And again, we got the biases, and we had to make lots of changes. There were lots of questions that we had to answer, and those were biases again related to Ayurveda, because this field is not understood correctly. So our job was to make it easier and understandable for them. And now we are fully accredited by the consortium as a fellowship. And these are the number of medical schools and health centers who are part of the consortium. And yesterday was different. People were flying solo. They were really working hard, as I did and many others did in this country, who were trailblazers in integrative medicine. But all of this is happening now. We have an American College of Lifestyle Medicine. I talked about the consortium. There's American Board of Integrative Medicine. We have a Society for Integrative Oncology. I practice in oncology. I practice integrative medicine at the Cancer Center at Hennepin Healthcare. We have Academy of Integrative Health and Medicine. We have the Arizona's program. We have residency programs. This is something, it was started in family medicine and at University of New Mexico. I started the first internal medicine in residency program. Sorry, in the internal medicine program. That was the first one in the country. We also have it, Hennepin. We have fellowships. Now we have fellowships. But this is where we are getting stuck about Ayurveda. The unfortunate fact is that there are fewer practitioners of Ayurveda in this country, and fewer people are using it. NIH says that only 250,000 people in the US use Ayurveda. I'm not sure how they got the number, but maybe there is a larger number. So our job is to really support and promote Ayurveda. And why? Because Ayurveda is one of the most ancient systems of medicine in the world, and its roots were reaching back to the 9th century BC. And it is said that Lord Brahma, who was the god of creation, who is the god of creation, upon recognizing that there was intense suffering on the earth, he gave the human civilization and taught various spiritual leaders, the sages, ways to ease the suffering. And that's how Ayurveda came about. For thousands of years, these teachings were transmitted orally, but then they were recorded during the Vedic period of ancient India as Sanskrit poetry. So, whole Ayurveda is written in Sanskrit. And that was compiled into the classic books of the four Vedas. So these are the Rig Veda contains verses on the nature of health and disease, and discusses the concept of three doshas, the Vata, Pitta, Kapha, that you are going to learn more about. And the Atharvaved lists the 8 divisions of Ayurveda: internal medicine, surgery of head and neck, ophthalmology and ENT, otolaryngology, toxicology, psychiatry, pediatric gerontology, and science of rejuvenation and the science of fertility. This is so fascinating that 5,000 years ago, the sages knew about these divisions. Like, where did this knowledge come from? That they have described the different disciplines of medicine and surgery, and it is all written in Sanskrit. And you can learn from those phrases, those Vedas, the verses. They have described blood, they have described lymph, they have described glands, they have described bones, they have described bone marrow, and how these things flow. It's just mind-boggling. So this is why it is called the mother of medicine. Then there were samhitas written. The Sushrit Samhita is, you probably have heard about the Sushrit Samhita, which is the widely accepted Ayurvedic text which outlines surgical techniques, right? So, and Charak Samhita is a major text on internal medicine. So you've seen these ancient pictures of performing surgery in India in these Samhitas. So the knowledge is so deep, and I think we should feel very proud of our culture and our medicine, and where we are coming from, and how it is really has defined the field of modern medicine. You are learning a lot about diet. You are hopefully eating sattvic food, and you may have heard about digestion, which you'll hear today. I believe that the new research on microbiome is really coming from the concept in Ayurveda, because Ayurveda believes in the gut health. If your gut is not healthy, you are not healthy. And the whole research on microbiome and gut health is based on the principles of Ayurveda. So Ayurveda can be integrated within the scope of any healthcare practice. It's applicable to all walks of life. It's a profound body of knowledge. I don't need to say that. And it really opens that door for connection with yourself and with a spiritual practice for those who are looking for that. And that's what I heard from the fellows. They have joined this fellowship because of that spiritual connection. These are some of the recent advances in Ayurveda which are happening. One is technology. So Ayurveda prescribes or believes in the constitution of the body, and prescribing you or giving you very customized diet plan, customized herbal preparations, which are medicines. And this is basically, you can think about that these principles can be used for drug formulations. In practice, we see that for some people, a certain drug doesn't work, right? And then we give them a different drug for hypertension. Why does that happen, right? Why is their body constitution different? And American medicine, conventional medicine, we give the same drug to everyone, but it doesn't work for everyone. So this is where the research is going to look at the modern biomedical research and how to make drug formulations and study the patient outcomes. So genomics is going to be a big thing for Ayurveda as we get more and more people involved in that. And then the other research is happening in the quality products for Ayurveda. So this is where Ayurveda or alternative medicine gets the bad word of mouth, that the products are contaminated. If you look at the studies, the first thing, this is what's asked in the board exam. What is causing contamination? People say lead. Okay, I got that answer correct. Okay, so Ayurvedic products have been found to have in America contain lead products. So that gives bad name. So now they're working on technology and looking at the higher qualities of products. And we have many companies now making higher quality of products. And they need to be evidence-based and science-based. So that's another area of research. And then what I talked about is personalized and precision medicine. I think Ayurveda has a huge role in personalized and precision medicine in that movement, is how everyone is different and how we can, not every chemotherapy is going to work for a cancer patient. So what can be done? So these are the emerging areas in Ayurveda. And I think I've already summarized that how Ayurveda can be used for self-care, for personalized nutrition, for routine and rest. You are going to hear more today as some of the details. As I said, people are joining fellowship to care for others, to care for themselves, to care for family members. And really recommending I like to bring both integrative medicine, general integrative medicine, and Ayurveda into my practice of integrative oncology, where I recommend all of these things which are listed here. It's not that I'm only recommending Ayurveda. They are getting acupuncture, but they are also doing their diet. They are doing mind-body medicine, and everyone gets to have a taste of that, whether that's transcendental meditation or mindfulness meditation or just a simple relaxation or breathing exercises. It really empowers patients, and you can combine these approaches in your practice. And I feel like the time is now. If we do not do this now, and we do not do this through API, I'm really fearful that the science and art of Ayurveda is going to be left behind. And we will continue to have other forms of medicine, which are going to get more popular in this country. And the time is now, because we are doing so poorly in conventional medicine and healthcare outcomes. And we need to have a different system. We need to have a different thinking. And we need to have differently thinking clinicians, providers, doctors in this country, because only doctors can make that difference. When you tell a patient to do something, that is more likely to be accepted than somebody else saying that. It's been tested in smoking cessation. If doctors doesn't bring it up, patients don't engage in smoking cessation. So if we start to talk about Ayurveda with people in lifestyle medicine, they're going to hear about it. And I'm intrigued by patients' knowledge. They come and they tell you, and then I learn from that. I generally I have to be very careful in my practice, like who I'm talking to Ayurveda, whether that's going to even fit with their lifestyle. But I'm actually pleasantly surprised that some people say, "Do you know Ayurveda?" And I said, "Oh yes, I do." So now I can talk to you about that. So I think we just have to bring this up, and people will know. And I truly believe that maybe it's a solution to cut healthcare costs in this country if we can keep people healthy and getting in tune with our own bodies and supporting our own bodies. We can do that at a low cost. And again, I'm bringing up that it has a huge role, and that 250,000 number, we can increase that number. We can have more people utilizing Ayurveda in this country. If we get more training, and if we have more support, and if we have more clinicians practicing it. And coming to the basics, nutrition. That is the foundation of Ayurveda, is diet and nutrition. And it has been said so long ago, the doctor of future will give no medication but will interest his patients in the care of the human frame, diet, and the cause and prevention of disease. So thank you. These are some of the references. All these slides will be there at the API website, and David is recording. I'm on Zoom right now. David is recording, and the CME talks are going to be available at the API website. So I would like to just end my talk with any questions from you, and the QR code I talked about, which is also on my slide. So I will entertain any questions.
So the fellowship, is it online, in person, and how much is it?
It's online, and you spend 1 week here in your first year and second week, and it is that cost is all included in your fellowship cost. Shankri, do you know the exact cost? Is it
36,000.
36,000 for the whole program? And a significant portion of that we pay to Arizona to get that 500 hour of curriculum from Arizona, the 500 hours. So 36,000 over 2 years, and your room and board is included here when you come here on the MIU campus.
Arizona course does not include Ayurveda?
No. It has a module. I did that fellowship. It has one module, like few hours, 1 hour.